Hey guys, good morning. Happy Monday. Happy Cesar Chavez Day. Happy post plastic surgery day 10 for me. Been giving you guys a daily update, so I definitely will continue to do that. But if you guys are new here, I figure I would just reintroduce myself. My name's Maria. I had weight loss surgery 9 years ago. And then I had some regain. So I had a revision to a bypass in October of 22. I started taking the wonderful drug Mounjaro 6 months into that, and I lost 126 pounds. And just 10 days ago, I had a extended tummy tuck, lipo muscle repair, and a Mons lift. And so yeah, I just kind of share my journey with everything on here. So if that's something you're interested in learning more about, definitely hit that follow button because I would love to take you along with me as I go through this thing called life and learning how to maintain my weight long term. Anyway, so yeah, today is day 10 and I woke up and I feel fine. No pain. I am able to sleep flat on my back now. I do think it's a good idea to sleep with your knees up if you can at some point and just be careful with the movement because you don't want to stretch your stitches out, but it's getting comfortable for me to lay on my back, so that's cool, or on my sides. I still feel the numbing and stinging pain, but the stinging pain's not as bad and the numbing is starting to disappear. I'm starting to have more feeling in my abdomen. I'm completely done with my antibiotics and any pain pills. So really I'm just relying on Tylenol at this point. I still have all of my... It's like scar tape, I think, on my, except for on the side one that I gave you guys the update. So that's supposed to start falling off at the 2-week mark, which is about 4 days. So we'll start to see that come off. And then at that point, that's when I'll do some cleanup and start rubbing the Moderna skin cream on there to help hopefully minimize the scar on there. So we won't really know what that looks like until this tape comes off, but as soon as that does, I will share what that looks like with you guys. I've had a lot of people ask me about my belly button, so let me just go ahead and readdress it. My belly button was reconstructed. It looks natural because my doctor was able, I had enough skin that he was able to do I forgot, it was like a scarless or non-surgical procedure. Essentially, they just go in from the inside and pull down. So that's why my belly button looks natural. And for me, I actually really like that. Not that it really matters, but I kind of like having the natural look. Everyone is different, and I know some people have different belly buttons, but I was actually thankful that he was able to do that. So I'm super happy with my results. So hopefully that clarifies, but yeah, no. Essentially what my doctor did, just to give you perspective, okay, is he cut right here in the middle of my stomach, and then he takes the skin and he pulls it down, and then you see the incision down here. So I had enough skin and elasticity that, again, he cuts here and then he pulls down. And so because he had enough to work with, he was able to make my belly button look natural. But they pull from the inside. So hopefully that gives you a little more clarity. Sorry, my dogs are whining because it's almost feeding time, so I gotta feed them. Hey, wait, it's not time, guys. Just wait a second. My dog has medication in her food that she has to wait for, and then she just goes crazy. Hold on one. Let's see, what else? I got on the scale yesterday, and so I told you guys that I was bouncing from 157 to 160 before I had plastics. When I went into the plastics office, mind you, I had eaten and had clothes on. I was 165, but then when I went in for my 1 week or 6-day appointment, I was 165, but I got on the scale yesterday, I was 161. So I'm going to weigh myself today after I go use the restroom, and I'll let you guys know what that looks like. But honestly, even if I had gained weight, I wouldn't really be worried about it. But a lot of people talk about how they gain like this crazy amount of excess water weight, and that just wasn't the case for me. So I told you guys I'm going to be candid and share what my journey looks like, and that's what my journey looks like. So I'm going to continue to do that. Also, if you guys didn't see in my last video, I had got my Mounjaro, so I did it on Saturday. So I'm back on that. Don't know if I'm going to stay on that long term, but I just really like what the drug does for me and my maintenance. So I'm going to stay on it for a little while, and to be continued. We'll see what that looks like. But Dr. Russo doesn't think that I need to stay on it long term. So I guess really the reason too is like I jumped through hoops to finally get this last 7.5. So I'm like, you know what? I'm going to freaking take it. So, yeah, but I got to get these dogs fed. I will come back and give you guys another update if I think of anything else major, but that is essentially my 10-day post-plastic surgery update for y'all. Have a good, happy Monday.